Calendar for the day. The first bill on the calendar for the day is House File 3100. The clerk will report the bill.
House File number 3100, number 1 on the calendar for the day, an act relating to health care, establishing an emergency insulin program, the fourth engrossment.
I recognize the member from Hennepin, Representative Howard, the author of the bill, to describe the bill.
Madam Speaker, this is the Alex Smith Insulin Affordability Act, legislation that addresses the crisis facing Minnesotans across the state who cannot afford the insulin they need to live. Members, it's common practice to thank the members and staff that have contributed to such an important piece of legislation, and there are many, and you have my gratitude, but the people I want to start by thanking tonight are the Minnesotans with diabetes that have came to the Capitol, came to us, shared their stories, and fought hard to get this done. Alexis Stanley, who on her 21st birthday wasn't thinking about celebrating, she was thinking about being one more year closer to a financial cliff. She said that Alex's bill would allow her to be excited about her future instead of fearing it. Michelle Camella, who traveled from Thief River Falls to share her story at a listening session and told us she had to skip groceries that week to do so because she had struggled so mightily to afford her insulin. Parents like Leah Greenside and Sherry Wiltrout, who shared with us their greatest fear that their children who have type 1 diabetes would one day not be able to afford the insulin they need. Annette Gentili, who's been to the emergency room several times with DKA, unable to afford her insulin. Nathan and Sherry Laurie and their son Jet, who pay $16,000 annually for the insulin that their family needs, more than their mortgage, more than their car. Maria Isa Perez Hedges, who lives with type 1 and has a 10-month-old daughter, told us that without affordable insulin, she doesn't know what her future looks like. There are so many more Minnesotans that we need to thank. Abigail Hansmeyer, Sarah Ginsburg, Rob Kilborn, Jim and Leslie Farnham, Emma Bommywell, Kristen Hodson, Julia Davidson, Quinn Nystrom, Jason Broback, Malia Camara. I could go on and on and on because there are Minnesotans all across our state begging us to take action because their insulin is simply too unaffordable. And of course, Nicole Smith Holt and James Holt, who lost their son Alec. We heard this story last year on the House floor, but it bears repeating. Alec was 24 years old when he was diagnosed with type 1 diabetes. He was a restaurant manager and made too much money to qualify for public programs, but not enough money to afford the crushing cost of his insulin. Alec needed $1,300 to afford the insulin he needed, and he was waiting till his payday to be able to afford it. And on June 27th, 2017, Alec's mom, Nicole, got the phone call that no parent should ever have to receive, that her son was gone. Alec had $1,000 in his bank account when he died. It is beyond heartbreaking. Members, I told that story last year on this House floor, and we've been saying never again should this happen. But it has happened. Since we adjourned last session, 2 more Minnesotans have lost their lives rationing their insulin. Jessamiah David Scherer, 21 years of age, from St. Louis Park, is gone because he couldn't afford his insulin, and another Minnesotan as well. And what all these stories have in common are courageous people battling an unfair and challenging condition every moment of their day, every moment. They have fear and anxiety about an uncertain future, not just because they need to manage their disease, but because of the financial burden that comes with it. It is so incredibly unfair to them. And this is the reality for thousands and thousands of Minnesotans. Nearly 500,000 Minnesotans have diabetes. And for those who are type 1, they need insulin to survive. It's like water. And the price of a tiny vial of insulin that used to cost $30 now costs $350, a 1,200% increase for essentially that same bottle of insulin. And that's the reason why 1 in 4 Minnesotans are rationing their insulin, which is incredibly dangerous. It's the reason why social media and GoFundMe sites are flooded with people begging for help in their most dire situation. As Jessamiah's uncle told us through tears when he testified, insulin isn't a life-saving drug, It's a life-necessary drug. It's necessary to live, and it demands our attention and action. And that's what Alec's bill is all about. It will create a true safety net for Minnesotans so that never again will someone lose their life because they can't afford the insulin they need to survive. This bill blends good ideas from Democrats and Republicans and is the product of many, many months, frankly, more than a year of work. It's been vetted by patients and providers, and we'll be handing out letters of support from organizations supporting patients, nurses, doctors, pharmacists, hospitals. Virtually the entire care system supports doing something and moving forward with Alec's bill. To spend a little bit of time on what this bill will do, we create a safety net program so that if a Minnesotan is in need and cannot afford their insulin, they can go to their community pharmacy and get an emergency refill that moment. As we know from Minnesotans with diabetes, DKA can onset in a matter of hours if they don't have their insulin. So we need to create an emergent way for folks to access the drugs at their pharmacy, and that's what we've accomplished here. But we also want to connect folks to long-term, affordable insulin. And this bill takes good ideas from Senate Republicans and merges it with the House emergency side to connect folks with the navigator. And so if someone can access an affordable insurance product, we can get them onto an affordable care product. And we also codify language that would cap copays at $30 for Minnesotans whose insulin is already capped on state-regulated health plans. Those eligible for this program are the ones most in need, most at risk, most like Alec. Folks that are earning money that put them outside of qualifying for public programs, but not enough money so that they can afford the crushing cost of their insulin. And we're targeting those that are uninsured, underinsured, and Minnesotans on Medicare. We fund this bill through a shared model. We have about $1 million in state funding and setup costs, and the lion's share of the funding comes from a fee on insulin manufacturers. There are just 3 insulin manufacturers that control virtually the entire global supply of insulin, and those companies have seen their profits soar while the price of insulin has went from $30 to $350. Those 3 companies made $20 billion last year, and this fee would ask a fraction of those profits so they could have a stake in solving a crisis of which they've profited from richly. Kim Munson, whose daughter has type 1 diabetes, shared with us, when you have a disease like type 1, you need people to have your back. Members, we need to have their back. We need to have your back. The Alec Smith Insulin Affordability Act tells Minnesotans that we have your back, that no Minnesotan is going to lose their life because they can't afford their insulin, that your future is yours and isn't beholden to the profits of a broken healthcare system, that we hear you and that we will fight with you to make sure that your future is yours. And members, we all have that chance today to fight along our side, our neighbors. And so I look forward to the debate and look forward to us standing with Minnesotans and passing Alec's bill. Thank you.
There are amendments at the desk. The clerk will report the amendments.
Albright moves to amend House File Number 3100, the fourth engrossment, as follows, and the amendment is coded H3100DE1.
The member from Scott, Representative Albright.
Thank you, Madam Speaker. Madam Speaker, I might ask, just for sake of clarification, there is also an A21 that is a technical amendment to the DE. I'm wondering if we could take that up first.
Representative Albright, did you want to speak to the DE1?
Yes, ma'am. Thank you. Members, I don't think that anyone in this chamber disagrees with Representative Howard in terms of the imperative that is before us tonight. No one should be denied the opportunity to receive life-saving medication. But where we have a disagreement is how that is delivered from a perspective of should government become the arbiter and the administrator of that program, or, as I think it more simply should be stated, we should hold those that are providing that medication accountable. And so the DE amendment actually goes to that very point. We do fund it, as has been Representative Howard's case, through the Healthcare Access Fund. But instead of trying to establish another state-run long-term program to administer and to provide those reimbursements, we're actually holding the manufacturers themselves accountable for that and providing it in a similar fashion. Last year, unfortunately, in this body, and it's passed into law, taxes on Minnesota citizens were raised by $2 billion. I don't know that we need to increase taxes by another $114 million, as the Howard bill suggests. And quite honestly, I think by raising that $114 million, it just provides an opportunity for insulin costs to go up even more. I know that we've talked about it on a long-term basis in terms of the track record that Minnesota has in terms of establishing record-keeping systems. I won't go into their names. They, in some cases, go under the acronyms that shall not be named in this chamber any longer because of the problematic nature of what they've caused for Minnesotans. So, members, we do have a wheel. We shouldn't have to build a new one just because it's imperfect. And so I would make improvements to it by the DE amendment. Manufacturers continue to pay an incredible amount of money into the state of Minnesota for the opportunity to provide their insulin to the state and to the citizens of the state. I think we can make improvements to it for the vast majority of those that are needing it. And again, as I said, hold those that are providing those drugs to insulin-dependent folk accountable and provide it to them in a timely fashion. Thank you, Madam Speaker.
The member from Hennepin, Representative Carlson, for what purpose do you rise?
Madam Speaker, to a point of order under Rule 4.05.
State your point of order.
Madam Speaker, Rule 4.05 provides that if an amendment would increase the spending or spending base from any fund from which appropriations are made in the bill, or would increase the spending base in total from all funds in the bill, or would increase the spending at all in the absence of a budget resolution, it would be out of order. And if you take a look at the amendment, lines 8.30 and 8.31 would spend more money for more years, and therefore it would be in violation due to the absence of a budget resolution. That's when this Amendment 4.05 kicks in.
Representative Albright.
Madam Speaker, advice.
Advice.
Thank you, Madam Speaker. Chair Carlson, the DE amendment actually spends less from the Healthcare Access Fund when we look at the numbers actually listed in the bill. We remove funding for the Navigator training program, administrative costs at MNsure, which are no longer necessary based upon the schematic that is provided in the DE amendment. Not only that, but the DE1 amendment makes fewer changes to eligibility that likely actually would reduce the actual costs of the program. So our DE overall costs less than Representative Howard's bill, and in both in defined terms as well as undefined costs of operating it for the emergency program. Thank you, Madam Chair.
Thank you, Representative Albright. I have listened to the point of order, reviewed the rule, and listened to the advice, and I find the point of order well taken. Representative Albright.
Madam Chair, I would appeal the ruling of the chair.
Representative Albright moves a ruling of the chair, and seeing 10 hands, there will be a roll call.
Thank you, Madam Chair. Members, this is a straightforward program. We're streamlining it for the benefit of securing accountability on the point of those that are providing the insulin. No one can disagree with the initiatives or motives of Representative Howard. Certainly, I have constituents in my district who are imploring me to get something done. But when you're adding layers of bureaucracy and costs that are unnecessary in order to provide the very nature of what Representative Howard is trying to accomplish, I think that we can provide it in a more streamlined fashion, and I look forward to Representative Howard's work as he moves this bill forward. Thank you, Madam Chair.
Sorry, you were right. It's 15 hands for a roll call, 10 hands for a call to House. Representative Howard.
Madam Speaker, advice? Okay. Oh, she's already moved. A lot of practice.
At this point, we're at the debate of the appeal. Representative Howard.
Thank you, Madam Speaker. In terms of the Healthcare Access Fund, what this amendment does, members want to be clear, the bill before us asks insulin manufacturers to pay a fee to largely cover the cost of the insulin. This amendment would take that money from taxpayers, from the Healthcare Access Fund. So it's clearly asking for a larger take from Minnesota taxpayers. We think it should come from manufacturers. The other thing I'd mention is that this amendment is the first we've seen of it in over a year. We had 7 committee hearings. The only amendment that's been adopted is one brought by Representative Scott that's now incorporated into this bill, a data privacy amendment. It clearly is not workable and violates Rule 4.05. Thank you.
Further debate on the appeal of the ruling of the Speaker. And a roll call having been requested. Representative Albright, you'd like to close.
Thank you, Madam Speaker. Representative Howard, fundamentally I agree with your purpose, but I fundamentally disagree with your statements with regard to the Healthcare Access Fund. We're actually taking less out of it. If you read the amendment, it does not take out more. With regard to a taxation, we're using money that is already provided to those in need. That's what the Healthcare Access Fund is for. I can't think of a more appropriate way to provide needed funding for a program for people that need it most desperately. With that, Madam Speaker, I thank you.
The question before the body is, shall the decision of the Speaker stand as the judgment of the House? A yes or a green vote supports the ruling of the Speaker. A no or a red vote goes against the ruling of the Speaker. The clerk will take the roll. The clerk will close the roll. There being 72 ayes and 54 nays, it is a judgment of the House that the ruling of the Speaker shall stand. There's an amendment at the desk. The clerk will report the amendment.
Schumacher moves to amend House File Number 3100. The fourth engrossment as follows. The amendment is coded A18.
The member from Rock, Representative Schumacher.
Thank you, Madam Speaker and members. Members, we all came here with the promise that we would work towards lowering the cost of health care throughout the state for the people of this state. And in large degree, we worked to actually accomplish what we told the voters that we would come here and do. And this amendment is an extra effort to do just that. This amendment requires the legislative auditor to review the impact of this bill on the cost of insulin. And it would require that if the cost of insulin causes the prices to go up, that this bill would be paused until we could make remedies for that later. This bill is a tax. The bill itself is a tax deduction, is a tax increase on insulin manufacturers, a tax that will raise more than $114 million over the next 3 years. The bill actually asks the insulin manufacturers to pay more for the program than the opioid bill did last year, and asks opioid manufacturers to pay their part in fixing the crisis. We would be collecting over $20 million a year from opioid manufacturers, and this bill collects $38 million per year for the insulin drugs there. The provider tax that was added on to healthcare cost at a charge of over $2 billion last year already adds to the cost of healthcare, and so we just want to make sure with this amendment that if the costs are going to be found, not because the drug manufacturers tell us it's going to, or because the health plans tell us it's going to, but because the legislative auditor finds that it's going to, then we can take a pause and make sure that we get this right so that people aren't paying more for their health care cost instead of what we are actually trying to accomplish with this bill. And Madam Speaker, I would request a roll call.
Representative Schumacher requests a roll call. Seeing 15 hands, there will be a roll call. Representative Howard.
Madam Speaker, members, I urge a no vote on this bill, or on this amendment. Pausing is absolutely the last thing we should be doing. Minnesotans are at risk of losing their life, and we need to move forward and make sure that those in need can access insulin. I will also make the comment that we don't need to fund another study to tell us that the cost of insulin is going up. We just need to talk to our patients that see that every single day when they walk into the pharmacy. The current system, the status quo, is leading to incredibly high prices of insulin year after year after year. And if we want to do something about that, we should pass this bill, we should pass Representative Morrison's drug transparency bill and others. And the only other thing I'll mention, members, the opioid bill was mentioned, and that bill passed with bipartisan support last year and held opioid manufacturers as part of the solution to fund this, and we should do the same here. Thank you.
Further discussion on the amendment? Seeing none, the clerk will take the roll. The clerk will close the roll. There being 53 ayes and 73 nays, the motion does not prevail. The amendment is not adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 3100.
Third reading. Discussion to the bill. The member from Dakota, Representative Garofalo.
Thank you, Madam Speaker and members. And first of all, I'd like to start off by thanking the fine members of the Legislative Budget Office for their work. For those that don't remember, back in 2017, an important reform that was championed by former Majority Leader Tom Bach and former Speaker Kurt Daudt involved taking the fiscal note process and moving it out of the executive branch and putting it into an independent purview of the legislative branch. The result of that is that today we're seeing for the first time on a major bill the analysis of a fiscal note that is really some exceptional work and will be the basis for how we will be building trust and confidence in the fiscal notes that we're receiving. So to the degree that anyone on that side of the aisle reads fiscal notes anymore, I would really encourage you to read the 34-page note that was provided by our Legislative Budget Office. They did an exceptional job in putting together materials to show the true cost of what this program is, the massive expansion in terms of cost to the state of Minnesota and through those who are purchasing medicine. Members, the healthcare system in the United States is totally screwed up. It's complicated, it's intricate, it requires a deep and thoughtful analysis, conversation, and debate. And that would be the ideal measure that we would like to have in our healthcare policy. Unfortunately, what we have instead is this sort of second-grade, dumbed-down narrative of healthcare policy. The insulin manufacturers are bad. Boo, hiss. Only the Democrats can save us. Yay. It's a much more complicated issue than that. And to understand it, all we have to do is look back at what has happened in the area of insulin in the last year. In the last year, the advocates have been extraordinarily effective at getting 3 major changes taking place. Number one, they were successful in getting the Internal Revenue Service to change the classification of insulin as a preventative medication. Now, getting the federal government to do anything is an impressive accomplishment, but getting them to do something that's good and provides an immediate impact, that was substantial, and it was not the result of politicians, it was the result of the work of the advocates. Second thing is, the advocates went to the pharmaceutical industry and got them to step up and expand their patient assistance programs, and not in a narrow fashion. So now, in the state of Minnesota, a huge percentage of the population that a year or 2 years ago did not have access to low or no-cost insulin now does as a result of these patient assistance programs. And third and finally, as a result of a change in state statute last year, we are now requiring that patients under Minnesota health plans who use insulin, the rebates the insulin manufacturers are providing, the insurance companies are required to take those rebates and pass them on to consumers, not use them to pay for other health care costs, not to pay for other expenses, but rather to have those rebates from insulin go right to consumers. Now, it's this third point that it's important for members to understand. Because last year we had a debate on the special session on the Health Care Access Fund and how to pay for this, and there were 2 competing narratives. The narrative primarily from the DFL was that these big bad insulin manufacturers were stuffing money in their pockets and ripping off insulin consumers, that they were taking all this money and they were keeping it. The second narrative, which is predominantly by this side of the aisle, was that in fact it was the supply chain, that the money was actually not even making it to the insulin manufacturers, that it was being gobbled up and used to subsidize other forms of health insurance, that people in the system were not passing on the rebates. Now, as a result of the work of Senator Michelle Benson over in the Senate, she was able to get our statute changed last year so that those health plans have to take those rebates and push them up forward to consumers. And what were the results? Stunning. Now, on the Minnesota health plans, every single person who's accessing insurance in the individual market in MNsure, every single person has access to zero-cost insulin or low-cost insulin. In one bill, Senator Benson completely destroyed the DFL narrative that it was the insulin manufacturers who were responsible for this. A bill which, I may add, our friends in the DFL, whether they knew it or not, were voting for, provided the opportunity to demonstrate that those rebates were, in fact, being withheld from consumers. And once they were passed on to consumers, it corrected the problem. But again, today, when we're debating this bill, it's not a matter of whether we have low or no-cost insulin to the vast majority of Minnesotans that have changed as a result of these 3 issues. What we need to have is an opportunity for some people to have a press conference, to have elected officials take credit for the work that has been provided by the insulin advocates. So as this bill goes forward today, I'm going to be voting no on it. We do not need a fiscal note of this size. We do not need government spending of this size to duplicate and triplicate programs that have been available in the last year to assist those with low-cost and no-cost insulin. I look forward to this bill when it comes back from conference committee with something that recognizes the fact that the insulin manufacturers, the changes in the IRS rulings, and third and finally, the changes that Senator Benson authored that made Minnesota regulated plans provide insulin at cost, not as a profit center. I look forward to that item returning to the floor from conference committee. We can actually have a true solution. Thank you, Madam Speaker.
The member from Blue Earth, Representative Munson.
Thank you, Madam Speaker. And to Representative Howard, I, again, appreciate all the hard work that you put into trying to make this bill better. Unfortunately, in the three times I've seen this bill, it has gotten larger and larger in its scope, and I still don't, I think you're missing the major point. The first time we heard this bill in the Health and Human Services Finance Committee, the fiscal note came to us in committee, and it was $10.4 million, but it only addressed people without insurance, which is a very small group of people that made too much money for government programs but did not have insurance of their own. And then in the interim, we had another version that expanded it to people with insurance and to people that made up to $150,000 for a family of 4. And now this third version of the bill came to the Health and Human Services Finance Committee, and I've been hounding the author for months to get a fiscal note. And the fiscal note, which is 34 pages of detailed information, became available in the HHS Finance Committee a half hour after it started, about 20 minutes before the members of the committee were forced to vote on it. The Health and Human Services Finance Committee is where we're supposed to critique the financials of legislation. We'll be able to put time into understanding not just the numbers, but the reason why, in all of the assumptions that are made, because this bill is full of assumptions on what things are going to cost. Each agency that this bill touches comes up with their formula, how they assume the costs involved in this bill. So I sit on the House floor, and we've got 32 committees out there, and the bills that come to the floor, I assume, have been vetted by the committees they've been assigned to. But members, the HHS Finance Committee did not vet this bill. Not one person on the committee read the fiscal note before they voted on it. Not one person on the committee could offer amendments to the bill because we didn't have access to the fiscal note to understand the reasoning why these numbers are the way they are. Republicans last year, we were pretty upset about the rule change and how bills were bouncing around between committees and this could possibly do it in the same day. And so we fought to have a fairness in the rules. And those rules change were adopted this year. But this bill circumvented those rules by being cloned. Not once, but twice. There were 3 bills bouncing around in different committees. So we couldn't even track the changes of the bill appropriately. And now we're being asked to pass this bill that has not been scrutinized by committees. It should be difficult for bills to become law. That's why we have this committee process. But this bill was crammed through committee, and the people that put all this time into what they're supposed to be doing were not able to do their jobs. My largest complaint about this bill, and I've expressed this to Representative Howard, is how the fee is calculated. And I'm going to give everybody a very simple example. Let's pretend there's 2 manufacturers of insulin. Let's just call them manufacturers of apples or apple growers. One sells red apples and one sells green apples. The red apples sell for $5 a pound. The green apples sell for $20 a pound. And in the state of Minnesota, there's 100 pounds of each sold. So red apples bring in $500 in revenue. The green apples bring in $2,000 in revenue. And the state, of course, charges $500 to administer this Apple program. So it's $3,000 in cost. But like this bill, each of the manufacturers is assessed their share of the fee in proportion to the number of units that are sold in the state, irrespective of revenue. So the Red Apple company that made a whopping $500 in revenue has to pay $1,500 for their share of the program. And the Green Apple company that raked in $2,000 in revenue only has to pay $1,500 for their fee of the program. This is exactly what Representative Howard's bill is doing in assessing this fee. It is rewarding the highest cost insulin manufacturer, and it is penalizing the lowest cost insulin manufacturer. We already have a problem with the high cost of insulin, and this bill gives an incentive to raise the cost of insulin. And that is what we're doing. Not only are we charging a fee, which of course should be added back into the supply chain to be fair. If they absorb the cost and spread it out across all of the other states, that violates the Constitution's Interstate Commerce Clause. So they must push the fee back onto Minnesotans. But when you give a company an incentive to raise the cost so that they can actually profit off of this program, you're doing the wrong thing to all the insulin users who don't participate in this program to take advantage of their fellow diabetics and paying more for insulin. This is a wrong bill. This fee is incorrectly constructed. You can charge it back on how much they receive in revenue because the government is paying for it. We know. But it's not. You're charging back in proportion to the number of units sold, irrespective of the price. I have a lot of problems with this bill. But the core structure of the fee and the way it's done is wrong. The Health and Human Services Committee met with doctors from the Mayo in our special session down in Rochester. And the doctors testified there's 3 main reasons why we have a high cost of drugs in this country. First of all, the government refuses to negotiate on drug prices. From the party that actually wants to put government in control of our health care, government won't even negotiate with these drug companies because pharma has their money so deep into politics. The second issue is that government won't allow us to import drugs from other countries. So we continue to subsidize all of the other countries around the world and their costs. Ours continue to go up. And the third reason, members, is pharmacy benefit managers. We had a bill last year that was bringing price transparency, but there are many other states that passed PBMs that ban rebates. And this bill doesn't address this problem. The other issue with this emergency insulin program, Representative Howard, is that we require, if someone is in dire straits and they have an emergency, that they have to have a valid prescription for insulin. And it's possible that people that need insulin can't find their prescription. And for the emergency insulin program, when somebody's in dire straits, we still charge them $90 for a 3-month supply. You still have to come up with money. It's not going to take care of the people who are in absolute dire straits. And to say that 16,000 people would qualify for this is going to grow the program significantly. And I've looked through the fiscal report now that I've had it for several days, in the modeling to show consumer behavior, people that are going to want to take advantage of the program because they're paying the fees for this insulin anyways. And then, of course, employer behavior, because we address it with people that have employee-sponsored plans, but only if their deductible meets a certain threshold. The employers are going to increase the threshold, increase the deductible for their plan just to drive employees to be able to get their free insulin so the employers can save money. This plan is going to balloon. And quite possibly the most important issue that I think most Minnesotans need to understand about this program is why diabetics? Why are diabetics getting everything for free or nearly free? And we have so many prescription drugs out there, hundreds of drugs, hundreds of procedures that are out of reach for Minnesotans because we have a significant problem with the health care costs. Why not cancer patients? As a doctor at the Mayo Clinic testified to a cancer drug that 150,000 patients are diagnosed with a specific type of cancer that costs $800,000 a year to treat. It is beyond their reach too. Why not all patients? Is it because diabetics have the best lobbying group out there? Is it because just about every one of us knows someone with diabetes? And then if they can get this through, this is the foothold in the door for complete socialist takeover of health care. So, members, I'm going to be voting no on today because this bill is not ready. It was not properly scrutinized by our committees, and this fee gives an incentive for the manufacturers of insulin to increase their cost, not to lower it. Thank you.
The member from Sibley, Representative Gruenhagen.
Well, thank you, Madam Speaker and members. Yeah, Representative Howard, I understand your desire to solve this problem. I want to solve this problem, and I think everybody here wants to solve the problem. We did have a solution last session that was presented. It was bipartisan. It was voted on, but it was defeated. But you know, my concern as far as the bill is concerned, I do think Senator Benson and working with the private pharma companies is the right direction to take on solving this problem. And here's why, members. I've sold health insurance since 1978, and I was only 20 years old. No. So I've seen the progression of all this. I sold health insurance when you did not have to get pre-authorization. I sold health insurance when there were no networks. You could go to the provider of your choice, okay? So I've seen a lot of change over that period of time. And one of the things I've noticed is every time government passes a law, federal or state, things do not get better, ladies and gentlemen. They get worse. Now, the latest example I can use is Obamacare. Okay, Obamacare promised 100% coverage, $2,500 savings on premiums. If you want your doctor, you can keep it. All of those turned out to be lies, ladies and gentlemen, all right? So when government gets involved with health care, 99 times out of 100, things get worse and not better. The costs go up, access gets reduced, and patients suffer. You know, I'll give you another example. We had a presentation in HHS committee just recently, this past week, I believe. by an economist working for DHS. According to his study and statistics, and this is after Obamacare was passed, 1.2 million Minnesotans did not access the health care they needed because of the fear of high cost. Members, I'm going to repeat that. After Obamacare has been passed in 2017, which was supposed to solve all these problems, according to his study, 1.2 million Minnesotans did not access the health care they needed because of fear of high cost. That's what government has produced, broken promises. I believe we can solve the problem for insulin access without getting government completely involved and with subsidies or taxes, thereby driving the cost up higher, convoluting and making it complex, the system. And the next thing you know, we'll have a shortage of insulin in the state, all right? I think Senator Michelle Benson and Representative Garofalo explained is on the right track. I believe the Senate's on the right track. I believe all of us want this solved, especially for people who don't have insurance. And by the way, under Obamacare, it reduced the uninsured rate down to 4% in the state. But now the rate has climbed back up to 7%. So we're going the wrong direction. Remember, when government gets involved in health care, 99 times out of 100, things get worse, not better. We also have statistics that show under Obamacare our doctors, 53% of them are stressed out because of the requirements under Obamacare. The essential benefits actually excludes needed treatment coverage that used to be covered prior to it of autism and certain PANDA coverage, all because of government involvement. Think about that, members. Let's send this bill back to committee, work with the Senate to come up with a compromise that works with the private sector and actually help the people without driving up the cost for the people who really need the insulin. Finally, members, I had a customer come in several years ago after Obamacare was passed, and I noticed these drug prices were skyrocketing because evidently something happened under Obamacare to allow this. So he comes into my office and he says, "Glenn, I'm going to die." I said, "Well, we're all going to die, okay? So what's the problem?" And he had been a long-time customer of mine, about 25 years. He said, "Well, I've got a rare form of cancer, and there's only one treatment. It's taking one pill a month, and it doesn't cure the cancer, it only suppresses it." Okay? I said, "Well, you've got a Part D drug program. That should cover the medication." Well, he said the doctor said it's experimental, and he didn't know if it was covered. So I said, "Well, what's the cost?" He said, "One pill, once a month, $9,000 a month, members. It's $108,000 a year." And he was ready to not take it and die. We also have patients rationing the medication they should take because they're afraid of the cost they can't afford, seniors. Members, government 99 times out of 100 doesn't solve problems. They make it worse. Madam Chair, can I make a motion to send this bill back to committee?
You may make that motion if you wish.
I'll make a motion to send the bill back to committee, work with the Senate, and come up with a compromise that actually works.
Representative Gruenhagen moves to return. Representative Gruenhagen, you need to specify a committee.
Let's go with HHS Committee, Finance.
Representative
Since we didn't get a
Gruenhagen
chance to
moves
review it.
to send House File 3100 to the HHS Finance Committee. All those in favor, please say aye. Aye. Those opposed, please say no. No. The motion does not prevail. The member from Dakota, Representative Mann.
Thank you, Madam Speaker. So I just wanted to start off by saying that I disagree, and I don't think our healthcare system is broken. I think that it is working exactly the way that it was designed to work. We have a for-profit healthcare system, and that's what's happening. Insurance companies, PBMs, manufacturers, Everyone involved is making a profit when you get sick. So that's not broken, that's working by design. And, this narrative that Democrats are saying that manufacturers, these big bad guys, and they're just stuffing their pockets with money, we're not saying that at all. But we can't argue that with 42% profit margins and $18 billion in revenue and $80 billion in revenue and $18 billion in profit, that they're not putting a little extra change in their pockets. And we also can't argue the fact that a vial of insulin has gone from $30 to $300. It's the same insulin. Nothing's changed. And so, we hear, but they're doing rebates and they're doing coupons. Well, if insulin is affordable, why do we have to have rebates and coupons in the first place? And how many times, how many people have to come to our committees saying, I can't afford my insulin and I can't qualify for these rebates, before we go, oh, these coupons, these rebates aren't working? Because I will tell you that on a regular basis, I see people in my office and in the ER saying, I can't get my insulin. I don't qualify for the coupons and for the rebates. So that is not a solution. And lastly, we have this scare tactic that if we pass a bill that's going to save lives, then they're going to raise the price of insulin. They're already doing that. The price of insulin goes up regularly, and we aren't passing any bills. So more and more people are suffering, and more people are dying. People in Minnesota are dying from something they should not die from. So this bill, very simply, will save lives. And one last thing, Representative Munson said something that I found to be rather offensive, and he said that, why do diabetics get everything for free? I would ask you to spend one day in the shoes of a diabetic and tell me how great their lives are and how great it is that they get stuff for free. They live one of the most difficult lives that we could ever imagine. Every single thing they do, every single minute of their day is dictated by what is my sugar doing right now. So please, they're not getting anything for free. Thank you, Madam Speaker.
The member from Candido High, Representative Baker.
Thank you, Madam Speaker. We heard a couple of comments tonight about maybe the similarity about the opioid conversation. And as a lot of you know, we worked really hard in the last couple of years to pass nation-leading legislation that worked, and we got it through Minnesota. Very bipartisan thing, and again, I can't be more proud of Representative Olson's and my work on that, along with all of your support. But here's what I have shared with Representative Howard earlier, is that I feel like we are at a pivotal moment in healthcare conversations, because we here in Minnesota shook the heck out of the tree, and we, for the first state in the country, got manufacturers to the table with what we called a licensing reform bill. And what I recall last year, sitting here at the end of session, the very last thing that we did in this body was talk about the insulin bill. And I remember folks running over from the Senate, and that was changing everything, because I wanted to pass that bill last year. I remember Representative Hamilton and I were like, let's go for this. We were urging you on. There was members on the other side mad at us because we didn't want to ruffle the feathers and stop the wheels from closing things down, and I get it. I understand it's a process. Ms. Smith-Holt, I am so glad you're here tonight, because there's not many people that sit in our shoes that have lost a beautiful boy. Your son, I think, was 26 years old. My son was 25, and our medical community let us down. And I really honestly believe you and I have every reason to be mad, and we want to make it right so that no other children are lost. And I feel your pain. I have seen you in committee many times, and I cannot thank you enough for spending the hundreds of hours it takes to continue to lobby for this kind of change. And I want to tell you that what your message has done here in Minnesota, you did more for this issue than I could ever do for the opioid conversation, because you got the companies to step up. They knew we would fix this if they didn't. And I'm not saying that the idea that came out from the pharmaceutical companies that sell insulin have the perfect bill, but I will tell you, they came with a proposal that I begged the opioid companies to come and do this so that we didn't have to create legislation. We didn't have to create more work and more people to be hired at DHS and MDH and all these other things that we felt we had to do. I begged them to do this, but they heard you and they heard us, and they knew that we don't want to have that whole thing happen again. And so a year later, members, we're standing here, sitting here, addressing this issue that we have to deal with. Our system is broken. I really do believe our healthcare system is not anything like it used to be 10 years ago when Minnesota had a pretty good system in place. We've made it better in some areas, but we've made it horribly expensive. And I want to believe that if this program that was offered up to us by the manufacturers of insulin had been around when Alec needed his medicine, I want to believe he would be here today and we wouldn't be dealing with this. But it took the death of your son and your passion, and they picked the wrong person to get angry. And you should be rewarded for that. And I am, again, grateful for moms and dads that are fighting for our kids that should have never been lost. And for that, members, I can't support the bill because this is different, and they came to the table. And I think we have legislation, and we can maybe work on that bill and those ideas and make it better and make sure that there are penalties if they don't perform like they say they will perform, that there's no sunset to this, or whatever that looks like. But this is a different story. It's a different thing. I didn't see them breaking the law like I saw opioid manufacturers breaking the law. They're not in front of a judge trying to find billions of dollars in lawsuits looking at them. They followed the system. They made a ton of money. People in between made a lot of money, and everybody has their fingers on this thing. So thank you, Representative Howard, for working on this, because this was not fun and easy for you. You are a champion on this, so thank you. But in this case, members, I just want us to ask ourselves, does government really have to step in and fix it all the time? Can we just tweak some things that was brought to us? I think in this manner we can. And I think that this $30+ million a year in a cost does not need to be borne by the state of Minnesota and the taxpayers. But we're at a moment, I think, that the manufacturers for the next cancer drug, because it's going to be something else tomorrow. Today it's insulin, tomorrow it's something else, but it'll never stop because the money that they're making is incredible. I think we did some good things last year with reforming the PBM stuff. We have a lot of work to do, members. I don't see anything, a magic wand or a silver bullet in the next few years, but this is not the right bill for this because they actually have come to us before we pass any legislation with what I think is a pretty good idea. $25 copay, they've got emergency funding for emergency medicine, and they also have a longer-term plan. I think it needs more time. Let's look at this. But members, I ask that you just take a look at this. We can't fix it all because we think we can do this. We are not healthcare experts, so we should let those folks do it the right way without this. So thank you, Madam Speaker.
The member from Anoka, Representative Bernardi.
Thank you, Madam Speaker and members. I rise today in support of this bill and want to thank Representative Howard, all the committee members who have been working on this, and my colleagues who have helped make this bill possible. Today with us is Abigail Hansmeyer, and she is my constituent. She has dedicated her life and volunteered her time to help make a difference not only in her own life, but in the lives of Minnesotans. She's a mom, she's a wife, she is a daughter, she loves to read, She's involved in her community, and she has lent her voice to those of many Minnesotans, with nearly 500,000 Minnesotans living with diabetes. So as I highlight and share her story, this is a story of many Minnesotans. And thank you for your courage and your leadership and your persistence, Abigail. This bill will provide Abigail a safety net. She will no longer face the financial burdens of frequent hospital bills, missed work days, or emergency medical transportation in a time where she runs out of insulin. Abigail will no longer have to stress about the timeline to eligibility for patient assistance programs through manufacturers that have failed her time and time again due to eligibility criteria that doesn't reach far enough. Abigail will no longer be forced to ration her insulin and risk her livelihood, wondering if she will die an ultimate death in the absence of the insulin she requires every day, hour by hour. Abigail will not need to live in desperation to the point of utilizing black market insulin. She will be able to better manage her blood sugars and be able to overcome the fatigue and chronic pain that she has carried as consequences to high blood sugars introduced by a lack of insulin she has not been able to afford. Abigail, she will look forward to living a life instead of fighting for her life. 10 years of rationing insulin on and off has caused her to develop long-term complications due to high blood sugars, neuropathy, muscle spasm, prolonged diabetic ketoacidosis, insufficient kidney function, and multiple hospitalizations, which on occasion have pulled her close to death. These are all barriers that have greatly altered her life. She is forced to continue to ration her insulin in this way. If she is forced to continue this, she will not see her life into her 30s. And her children would not have their mom by their side to love and to guide them. There are things she has already sacrificed, more than financial burden. She's had to, since her health has been so compromised, she's not able to do the physical activities with her children like other moms and families do together. The financial burden of this vital hormone not only slows life from Abigail, it takes life away from her children, her husband, her parents, and all the people she loves and who loves her. The bill won't return what has been lost to her life due to rationing her insulin. It will, however, save her life in ways that as of now, she can only dream about until legislation sees the overwhelming potential it carries. So, Abigail, I want to thank you for your leadership. I want to let you know that we carry your fight within us, and we will do all we can to help you and other Minnesotans. And I can't wait to see you earn your master's degree and achieve your dreams. I can't wait till you become an entrepreneur like you want to be, and you publish your first book. I'm glad to be able to call you a friend, and I want to thank you for what you've done for Minnesotans, and we will continue this fight until it's done, to save lives in Minnesota and yours. Thank you. Members, please vote yes.
The member from Wabasha, Representative Drzkowski.
Thank you, Madam Speaker. Madam Speaker, members, thank you, Representative Howard, for bringing your bill forward, even though I'm not going to vote for it. Members, here we go again. We have, again this session, Minnesota Democrats have taken off where they were last session, bringing socialist policies forward, growing government in the notion, the wrong-headed, misguided notion that government is somehow going to be a solution. As a matter of fact, I think most people believe that this bill is somehow going to make insulin more affordable. As a matter of fact, the author of the bill suggested there are people who cannot afford the insulin they need to live, and that was his statement for why the bill is here. Well, members, this bill clearly is going to increase the costs of insulin in Minnesota. Members, the bill is going to tax people. No, Representative Howard, it's not going to ask companies, would you please, pretty please, give me your money. Representative Howard, the bill says we are going to use the full force of government to take money away from these manufacturers. Make them pay more to government. We all know when you raise taxes on an entity in business, all they do is raise the price. And members, that's what we have here, a misguided, big-hearted, if you will, but misguided approach, thinking government can be the center that will solve everybody's problem. Well, remember, that's not the case. We can't make a pharmacist out of government. We have professionals that are pharmacists that work within the healthcare industry and do their jobs each and every day. Those are the people who are pharmacists. Government cannot be a pharmacist. But this bill thinks it can make government a pharmacist. As a matter of fact, like all the rest of the radical socialist solutions that the Democrats brought last year, and they're bringing more this year, this is again going to grow state government another, not to mention the $76 million that it, per biennium that it is taking from the insurance companies, but the $2 million that is going to be spent and plowed into government in the state of Minnesota, another 14 employees in this huge government that we have here. And Minnesota government isn't the most efficient, successful, or able government we have to begin with. As a matter of fact, our government is very inept. Parts of it are rather corrupt. We don't have to look any further than Minshur. So, members, we're going to turn this $76 million and the pharmacy needs of people who need insulin over to the same government that's got Minshur. Minshur that has killed Minnesotans. Minshur that has interrupted and wrecked Minnesotans' lives in my district, in every district of people in this House. We're going to turn this over to that same government. The same government that invented and gave us 10 years of protracted false promises of MNLARS. Now, we hope that MNLARS is finally going to be ended, that government nightmare that we have in front of us that has wrecked the lives of many Minnesota businesses, that has made life difficult for people who simply want to get license tabs for their car. They can't even manage license tabs for cars, and we're going to turn over the pharmacy needs of people who are diabetics over to this same government. We're going to turn it over to the same government that handles CCAP, which already has $7 million of convictions for fraud in the state of Minnesota, may have as much fraud as $100 million going on that has yet, members, to be addressed. This is the people's money that this same government has taken from them, members. And we're going to take this money too and turn it over to this same failed, inept, and corrupt government. We're going to turn it over, members, to the same big, bloated, inept government that handles our Medicaid programs here in Minnesota. Hundreds of millions of dollars in waste and fraud documented by the legislative auditor, and those may be low numbers, members. It has yet to be addressed by this body, by the legislature, and by the governor, and the author and the radical Democrats want to turn this additional $76 million per biennium over to that same failed government. The same government that handles the federal SNAP program, that is ridiculed with fraud and waste. What do I remember? $30 million, I think, was the amount. This government can't handle that program, and we're going to give them another one. The same government that yesterday we just heard $29 million of duplicate payments to the HMOs, that the government is taking taxpayer money and paying the HMOs 2 or 3 times for the same person. Inept, corrupt government, and the authors of this bill, the Democrats, in their race to grow government, in their false notion that government is somehow this time going to do a good job, not mess it up, on top of that, is actually going to be helpful. Members, the same government that just decided not to collect $30 million of the people's money in unpaid MNsure premiums. We're going to turn it over to that government. The same government that handles our MNsure, our Obamacare program. The same government that built light rail that kills people and is full of violence today. That same light rail, yes, members, it's that same government that we are going to turn another $76 million that we take from companies to eventually raise the price of insulin on the people of Minnesota, the hardworking Minnesotans. That's what this bill is going to do. Members, Representative Howard, a big-hearted motivation, no doubt. Misguided, wrong-headed. It's going to do more of the same, members. We're going to add to this big government that can't even handle collecting the fare on the light rail. Members, please vote no to this bill. Send it back, and let's look for something else. Thank you, Madam Speaker.
The member from Dakota, Representative Halverson.
Thank you, Madam Speaker. Wow. It's a disappointing night for me to hear what people are saying after what we went through the past several years working to try to save lives in Minnesota for people who can't afford their insulin. And I want to bring it back to people with diabetes in Minnesota and people who love people with diabetes in Minnesota. These are the people that have been doing this work, and they've been doing it with passion, and they've been doing it with extreme patience. People with diabetes have been crystal clear. This is a problem. They told us that after last session, if we did not create an emergency insulin program for the state of Minnesota, more people would die. And their prophecy was accurate. Since that, 2 more people in Minnesota that we know of have died. And around the country, we know that people with diabetes are dying because they can't afford their insulin. And even more tragically, the people that this is hitting are young people. People who are aging off their parents' health insurance at the age of 26. People who've got a bright future ahead of them. Mothers who are having to say goodbye to their children. And they came to us and said, will you help us? Will you help us save lives? And they told us that 1 in 4 people with diabetes are rationing insulin. That's true in Minnesota, and it's true around the country. We heard from Representative Bernardi's statement what that means when you ration your insulin. It means short-term problems, high blood sugars, flu-like symptoms, illness. It also means hospitalization. In the long term, it means amputation. It means blindness. It means premature death. And premature death can happen for somebody with diabetic ketoacidosis in a matter of hours. Do you know what happens when you get diabetic ketoacidosis? Your blood turns to acid, and your organs drown in acid. It is a terrible way to die. And it was a death sentence until the invention and the discovery of diabetes. And we talked a lot about people who have made billions on the dependence of people with diabetes, on their insulin. And it really is like air. It would be like if you were being charged to breathe air. That is how vital insulin is to people with diabetes. And so there were billions made off of this, but you know who did not make billions off of insulin? Dr. Banting, who developed insulin at a public university, at the University of Toronto, who gave insulin to the world. Because it was such a miracle that children who died while their organs drowned in acid in their own bodies took insulin and could get out of bed, took insulin and gained weight, and they weren't starving. The before and after pictures of children in these studies are unbelievable. Look them up. Insulin is a miracle for people in this country, for millions of people with diabetes. I have diabetes. I have type 1 diabetes. And Representative Mann touched me so deeply when she said, walk a mile in the shoes of somebody with diabetes. Now, we all carry our bag of rocks, but I'll tell you, the people I see with diabetes walking around with their brave faces, you get your diagnosis. I'll tell you exactly what happens. You get your diagnosis, and you're sitting in your doctor's office, and you burst into tears. You burst into tears because of people you know who've been sick with this disease. You burst into tears because you know it's going to change your life forever. And then you walk out of your doctor's office with your plan, and you live your life. And you live a good life. And there are people who are sitting on our Supreme Court who have type 1 diabetes, and there are race car drivers driving NASCAR with type 1 diabetes, and professional athletes, and rock stars like Bret Michaels have type 1 diabetes. You can be a hero with type 1 diabetes. But it doesn't mean that the load is easy to carry. And it doesn't mean that we don't walk around with fear for what this disease could do for our lives. And so people with diabetes and people who love people with diabetes came to the legislature after the death of Alex Smith. And they said, this is a problem and we need you to help us. And they were told by legislators, it's not a problem, go to the emergency room. They were told that by legislators. They were told by legislators that people with diabetes just want something for free. They were told by legislators, there's not a problem. There are coupons. They are told by legislators that we can't help you. 1 in 4 people with diabetes are rationing their insulin in the state of Minnesota. That is wrong. People with diabetes deserve our help. They have asked for it. Not only have they asked for it, they walked side by side with the authors of this bill to make sure that the program we put in place would work for people with diabetes. Because they know what it's like to live with the disease. They know what it's like when you run out of insulin and you have an emergency. And I'll tell you, it's happened to all of us at some point where you're like, oh boy, it happened to me. I brought the wrong insulin to my cabin. And 9 o'clock at night, just as the pharmacy is getting ready to close, I had to make a run to Target. And my husband, I had to be like, slow down, man. I'm not going to die right now. But they kept the pharmacy open late so that I could get my insulin. It happens. It happens to all of us. But when you have an emergency where you can't afford your insulin and you're working a full-time job in this state, and you're trying to build a life for yourself and put a roof over your head, raise your kids, and you can't afford your insulin, and the legislature says, we can't help you, and you say, I've got a plan. This is the plan that's going to make sure that diabetics who can't afford their insulin can get an emergency supply when they absolutely, urgently need it. And tonight, I'm hearing legislators again say, we can't help you. I'm hearing legislators blame political parties for this issue. The lives and the health of Minnesotans are not a partisan issue, and I can guarantee you the advocates who have worked so hard on this have worked so hard to make sure that people on both sides of the aisle are engaged and working on this. They have not made it a partisan issue, and I ask our members not to either. The issue is real. These stakeholders did not come to the Capitol asking for us to do something. These stakeholders came to the Capitol and they asked us to pass the Alex Smith emergency insulin bill. And tonight, we have the privilege and the honor of getting to do that. Please vote yes.
The member for Mysanti, the Minority Leader, Representative Dowd.
Thank you, Madam Speaker and members. And I want to especially thank Representative Howard for bringing this bill forward. I may be in a weak moment. Ask the Speaker to appoint me to the insulin working group over the interim. Now, in my role, I've been Minority Leader or Speaker for the last basically 8 years, and I don't get to work on a lot of policy, but this is something that I thought was important, and I thought, you know what, I want to roll up my sleeves and just get involved. So I did, and we met a lot over the interim, and I actually learned a ton about this issue, and it was really very interesting. It was frustrating. It was eye-opening. It was a lot of different things. But what I do know, Representative Howard, is that you are very passionate about this, and you've done some really great work. I'm not all the way there on your final product, and I'm going to talk a little bit about that. But and somebody said something about maybe it was Representative Halverson about loving people with insulin. I don't question that every member in this chamber loves people who have insulin. I mean, we did some great work in the working group, and I think it was because this issue transcends politics. It transcends political parties. This is an issue that everybody in this chamber, I think, wants to solve. But we get frustrated because we're not always sure how to solve it. It's not just Representative Howard, but I had the pleasure of serving. Representative Liebling was the third member of the House that was on that committee. We also had Senator Benson, Senator Pratt, and Senator Wickland that joined us, so there were 6 of us that sat through a lot of meetings and had a lot of great discussion. There were times, I don't know what it is about this microphone, but I stand here and it's like true confession time for me, so I apologize. But there were a lot of times when I agreed with Representative Liebling. And what I just said is probably horrible for my political career and also horrible for hers. When I say this, I think about the Constitution and the fact that in the Constitution there's a protection for us that you can't be questioned anywhere else for what you say on the House floor. And I hope it protects us both for what I'm talking about. And I'm joking and in jest. There were times when we agreed. And what that told me is that we were doing really good work. And there were times when I agreed with and she knows, we sat across the table a lot from each other and we would kind of chuckle and make eye contact. But there were a lot of times I agreed with her and not the folks from my own party. But that was what told me we were doing really good work. I got frustrated a lot during this process. I learned that the whole insulin situation in Minnesota changed since a year ago. I learned how much the advocates care about this and how much work they've done. I want to thank all of you for the work that you've done. This is not a partisan issue, and you're going to have some people vote against this bill today, but it doesn't mean that they don't love your loved ones and they don't love you and they don't care about this issue and they don't want to solve it. We might just have a little different opinion of how to solve this issue. I ran into somebody at a dinner last week who said to me, came up and said, this insulin, the cost of this insulin, I'm one of those that's affected by this. And I said, oh, really? How much are you paying for your insulin? And they said, $350. And I was like, really? I said, I was like, there's a program for you. It's already in place. You don't need to wait for us. Nobody should be paying $350 for insulin. And I believe that right now nobody would have to if you'd access the programs that are available for you. And through a little more conversation, I asked about how this person got their health coverage or whether they had health insurance. And they said, oh, no. I don't pay $350. I only pay $25. But my insurance company pays $350. And I said, oh, no. Your insurance company that's the retail price that you see at the cash register, but they get a rebate back from the manufacturer. Nobody's really paying that. Apparently we will in this bill. I've got the fiscal note. We're going to pay $350 for insulin in this bill, but nobody else out there in the real world pays for it. In fact, we uncovered through this process, and I believe the real problem here is and we can't solve it. This is a federal issue. This is bigger than what we could do here tonight in one bill. But it's the price scheme on how we price pharmaceuticals in this country. There isn't, and I never can understand this. Why isn't insulin just $50 for everybody, right? And if an insurance company's covering you, they pay $50 for it. If you're getting it for free, the pharmaceutical company has to, $50 is not their cost. I guess they're going to make a little money on it. But, if I pay for it out of my pocket, it's $50. If I get it in a public program, the public program pays $50. It's not. I don't know that any two people pay the same price for insulin or any other pharmaceutical product. And this was what was frustrating. What we uncovered in this process was there's actually one type of insulin from one of the manufacturers that the state of Minnesota purchases for the people that are served on our public programs, so people that get their health insurance on our public programs. There's one type of insulin through one manufacturer that the state of Minnesota gets more in rebates than they pay for the insulin. Did you hear that? That is a fact. There's a type of insulin from one manufacturer. They have a different contract for every type of insulin. We didn't look at every one of them. But it was uncovered that one type, the state of Minnesota gets more in rebates than what they pay for the insulin. The state of Minnesota is profiting off of insulin. And what happens to the pharmaceutical company? I mean, this is the same problem with our public programs for healthcare, right? We hear that if people on public programs, that those programs don't reimburse our providers at a rate that actually covers the cost. So what happens to the provider? They're providing this, they have to cover the cost. So they spread that cost out to their other customers. So if you pay for your health insurance, or your employer does, you're subsidizing people on public programs. It's a fact. That's how our system works. And the more people that are on public programs, the higher the cost is for the people that aren't on the public programs. And it's the same thing with pharmaceuticals. If the state of Minnesota is actually getting more in rebates for one type of insulin than what they're paying for it, that pharmaceutical company has to jack up their imaginary price for the other payers, right? And then those payers, if it's a big insurance company that has a lot of customers and they buy a lot of product, they get to negotiate the price a little bit lower, right? Does anybody pay $350? I actually don't think so. I mean, if you're going into the pharmacy and purchasing insulin, the list price is $350, you could pay that. But what we learned through this process also is that the manufacturers have programs that discount it, coupon cards. I'm on a prescription that I have a coupon card for, and it reduces my out-of-pocket copay. It's just automatically in the system now. I gave it to them once. These are pretty easy. Pharmaceutical companies do this all the time because they're used to this pricing scheme. Now, I wish that pricing scheme wasn't the way that it is, but when I say we, government has created that problem. Government is the largest purchaser of pharmaceutical products, and they negotiate the low prices and have federal laws that demand that they can't pay more than a certain amount or that they must get rebates back or whatever. And it creates this scheme where nobody has any idea what they actually cost. Do you have every right to be mad at pharmaceutical companies? You probably do. I don't know. I chose to go into this just with open eyes and just not trying to judge anybody and trying to figure out what's the real solution that we can come out with. And in our bill, I would always hope that we would not do something that would create an unintended consequence, if you will. That we would, I don't like when we put fees on or tax. You don't tax a drug to lower its cost. You tax a drug to increase its cost. If we put a $40 million, whatever the number is, $38 million fee on pharmaceutical companies, what will they do? They will turn around and increase the price of their product, incrementally, to recover that money. So we're passing a bill that actually raises the cost of insulin. That's what we're doing. We're going to raise the cost of insulin. And then certain people are going to get it for free. They get it for free. We're going to pay the full retail price in the fiscal note. I don't know. I hope somebody somewhere in state government, in some agency, will negotiate this down. Maybe they'll do a better job of negotiating, and we'll actually make money off of it, like we're doing in some of our public programs. This, and I'm kind of saying this so you realize how stupid this whole thing is. This pricing scheme on how we price pharmaceuticals. And then I thought in my mind, I hope that we're not trying to punish pharmaceutical companies. I hope that this really is about helping people, because I can be on board with helping people. What this bill actually does is probably help pharmaceutical companies. Because right now, the people that qualify for this bill all qualify for the programs right now that the manufacturers offer. And a lot of these programs, we're going to pay the full boat, $350 a month, for the insulin. So instead of the pharmaceutical company giving it away for free or a discounted minimal copay, we're going to pay the full boat to the pharmaceutical company and give it away for free ourselves, or force them to. And then we're going to turn around and recapture that money by charging the pharmaceutical company, whatever portion of the $38 million. That actually sounds just as crazy as the pricing scheme. In all that I learned going through this process, the way to solve this problem is to talk to the pharmaceutical companies, and I didn't do this, but I'll bet you dollars to donuts that they would agree. Put in statute a requirement that every pharmaceutical company has to provide an emergency program and a long-term program that meets these minimum requirements. And put some penalty in that if they don't meet it, they have to pay, to incentivize them that they have to do this. And you could probably give that bill an enactment date of tomorrow, and those people are equipped right now to do this. They're already doing it. But we're going to create this new scheme that, is only going to make the problem worse. This bill will make insulin more expensive for somebody that buys it at the pharmacy. It will do that. I'm really happy with what Michelle Benson, Senator Benson, I should say, did and put in the HHS bill last year. And this is a great example of what we should do. She kind of exposed what happens with this pricing scheme by putting language in that said, if you're getting a rebate back, insurance company, if you get a rebate back, you have to turn around and pass that rebate on to your customer that you're providing the insurance for. And copays instantly went to $0 to maybe $25. I think that might be the highest one for everybody in every one of those programs. So what that tells you is the insurance companies aren't paying $350, but somehow in our bill, we're going to pay $350. And then we're going to turn around and recapture that money back from the pharmaceutical companies by charging them a big fee or a tax, which will drive up the cost of insulin for everybody else. It doesn't work. It won't work. It's not a good idea. Plus, we're not the ones who are equipped to provide this service. The pharmaceutical companies are. They're already doing it. And I think if we actually wrote that language and passed that bill, not only could they enact it very quickly, they would probably support the bill, and we would solve this problem with, I would guess, almost every vote in this chamber. And everybody would be on board, and it would be a huge win. And you could have a system set up where somebody could get a coupon or a whatever and go to the pharmacy today to get their insulin if they couldn't afford it. And that's what we all want. We want to solve the problem. But government's not equipped to solve this problem. Why? We created it with this pricing scheme. I should have thought quick enough to add an amendment to this bill that says the state of Minnesota cannot get more in rebates back than what they pay for insulin. We cannot profit off of insulin. Because when we do that, we are driving up the cost for other people who pay out of their pocket. We're creating the problem. But I'll tell you what, I have a lot of respect for the people that sat on this insulin working group. I'm glad that I did it. I learned a lot through the process. I think that when this bill melds with the Senate, it's probably going to look a lot more like what I talked about. At least I hope it does. And if it does, I'll vote for it when it comes back. Today I can't vote for this because this is a government solution to a problem that really is going to make it worse. It really will. I don't think that's your intent, Representative, and I have a lot of respect for you. I think you really have a passion for this, and I appreciate the work you put in. And thanks for getting it this far. But this bill is not something that we should do, and it's only going to make the problem worse. So I can't vote for it today, and I hope that over time we stop taxing or putting more fees on things and thinking they're going to get cheaper. It's never worked. It's never once worked. So I think we just need to do a little better job of not trying to think that government has to solve every problem, that we can maybe just put some guardrails in place, and people who are equipped to solve this problem quickly and efficiently and effectively could ride right inside those guardrails. That's the way to solve this problem. But if that happened, then we wouldn't get to say that it was us that was doing it. But you know what? I don't care. I don't want credit for solving this problem. I just want to make sure that people who can't get their insulin can get it. If they can't afford it, I want to make sure they have access to it. That's my number one goal. What this bill does is it gives free insulin to Minnesotans who already have access to free insulin. Think about that. That's what this bill does. This bill gives free insulin to Minnesotans who already have access to free insulin. Let's focus on the people who don't have access. Thank you.
The member from Hennepin, the author of the bill, Representative Howard.
Thank you, Madam Speaker, and thank you, members, for this debate on this bill. I really appreciate it. I just want to comment on a few things on that have been discussed. We've heard a lot about the current state of play, that insulin is available now, that these drug companies have changed their programs. Members, if the status quo is working, Minnesotans wouldn't be dying. People wouldn't be here begging us to take action. There wouldn't be a daily drumbeat of social media posts of people saying that they can't access these programs. If we truly listen to patients that have worked with these programs and experienced them, we have to come to the conclusion that they are not sufficient and that we need to take action. There's discussion about the fee on insulin manufacturers, and I think there's maybe some misconceptions about how it would operate. Keep in mind, insulin manufacturers, they produce a vial of insulin. It costs them about $6 or $7 to produce that vial, and then they pay, and then they make a profit of several $100s for it. In this bill, we simply would be asking them to cover the cost of the insulin that's being sold at the point of sale at the pharmacy, basically at the rate of what they've sold it for. That seems fairly straightforward. And what that allows us to do is make sure that we have a program that works and can be set up immediately. There's been some discussion about we're doing something new and can we do this. Very intentionally, we're utilizing the exact supply stream that Minnesotans currently utilize to access their medication. If somebody needs insulin, they go to the same pharmacy that they would access otherwise, bring their prescription, bring a very basic form that they will access, and they'll get their emergency supply of insulin. That's the reason that pharmacists support this bill, that doctors support this bill, that nurses support this bill. This bill is designed to work with our healthcare providers, guided by the input we've heard from patients so that we can set something up quickly that gets insulin in the hands of Minnesotans when they need it. Members, this is urgent, and I appreciate that this is the first bill that this House will pass off the House floor, and we know that the urgency doesn't stop here because lives are literally on the line. It's not rhetoric. And we absolutely have to feel wind at our backs. And many members here tonight have praised our insulin advocates. And we should realize, yes, that they have moved the needle so far on this. They've pushed forward. They have pushed for change. But members, we need to feel that wind at our backs too, because we're not done yet. We haven't done anything yet. We need to pass this bill because it is the safety net that does not exist today for patients that need insulin. And we've heard a lot about our healthcare system as a whole, our prescription drug system. It's been called stupid. It's been called messed up. We can debate about the causes. What I don't think we can debate, though, is that it's not working well for our constituents, for Minnesotans. It's not working well for Minnesotans, like Representative Halverson said, that have to manage this disease every moment of their lives and still have to save place in their brain for the fear and anxiety of not knowing if they can afford this drug. Our system is not working, and I think we all can agree on that. But members, this vote is our chance right now to stand with our Minnesotans that have type 1 diabetes. This is our chance to fight for them and to take a stand. And to my friends on the other side of the aisle, maybe you don't agree with every piece of this bill, but if you agree that we need to do something, this is our bill this session and our opportunity as a body to move forward with a strong vote and say it is time to take action right now because lives are on the line. And so I really hope that we can make this a bipartisan vote because it really isn't a partisan issue to stick up for Minnesotans who just want to live a happy life without the fear of not being able to afford a drug that they need to survive. Lastly, I need to thank Nicole and James. You are a hero. I am in awe of your courage every day, and we should feel the wind at our backs pushing us forward, and I know that this fight isn't over, and we will keep fighting until we pass Alec's bill. Thank you, Madam Speaker.
The member from Hennepin, the Majority Leader, Representative Winkler.
Thank you, Madam Speaker. Members, I hope we can all agree that Minnesotans should not lose their lives because they can't afford the medication they need to survive. I hope we can all agree that in one of the richest states in the richest nation in the world, people shouldn't die because they can't afford insulin. We have a problem. And the key word that Representative Howard used tonight was urgent. Many of you know that I have a child with type 1 diabetes. And this morning I got a phone call as I was getting ready for work from Isaac, just saying, "Dad, my pod failed." And if you have diabetes and you know what an insulin pod is, that's the device used to inject insulin into him and to keep a continuous stream of insulin going all the time so that his sugar levels don't rise, acid doesn't form in his blood, and he doesn't ultimately lose his life. That's what happens over time if you don't have insulin. So I did what any parent would do. I upended my day. I got the supplies together. I drove to school. I made sure he got his pod changed. And I didn't wait. I didn't decide that I had other things to do or that there were concerns I might have had about how my schedule was going to be confused today because of the need to get there. I got there. I did it. I didn't wait. And the people who have been advocating for the Alec Smith bill and a solution to the insulin problem have been waiting and waiting and waiting. They have been waiting for us to take action. And to be fair, we have taken action. The House did pass a bill that would solve this problem last year. In fact, the Senate passed a bill that would solve this problem last year. They passed it unanimously. And when we got to a conference committee, somehow magically the lobbying efforts of the pharmaceutical industry convinced Senate Republicans to drop that from the bill. And then we decided to start a negotiation process, a work group process, where we would have a discussion week after week after week about the need to solve this problem. Bring in experts, talk to the advocates, make them come back one more time to tell the same story, yet again, about a very simple issue. This has been delayed and delayed and delayed. And I'm not going to offer an explanation as to why one party might want to defend the pharmaceutical industry and create a barrage of explanations for why this program won't work and how, oh, Representative Howard, we do appreciate your passion, but your solution is not going to work. And thank you, advocates, for coming forward, but you really don't understand how healthcare functions. People understand how healthcare functions. This bill has been vetted. This bill has been tested. This bill has been sitting on our desk waiting for action for months and months and months. And that is why we expedited it through this process, because we cannot wait longer. Losing Alec was enough. Losing 2 more lives because of our failure to act is reprehensible. We know how to solve this problem. If you do not want to be part of the solution, step back, don't be involved, and let us get the job done. We are going to pass this bill tonight. We are going to send it to the Senate, and it's time for the Senate to step up and pass a similar version or the same version and get it done. We have a problem. Now, part of the issue, you would think this would not be so difficult. I think a lot of Minnesotans look at this issue and wonder, how in the world can it take so long for our legislature to provide a program to get access to emergency insulin for people who need it? They've seen costs increase 3 times in 10 years. They know that manufacturers are making a lot of money from this. They know that they can be part of the solution. They expect us to come together and bring everyone to the table and provide a solution. But the consistent position from the pharmaceutical industry has been from the beginning that they will not come to the table. They will not be part of the solution. They will not pay anything to solve this problem. And so the answer to the question of why can't they come together and get this done is because there is an industry that has the arrogant belief that they do not have to be part of the solution. So part of the discussion that we're having tonight, members, is about insulin and about the needs of families who have diabetes and need to take care of their family members. I understand that. I know that I'm not probably going to be in a position where Isaac isn't going to be able to afford insulin one day, but who knows? I might not be around. Who knows what happens in his life? There is no protection in law. There is no program that we've created in this state to preserve his life in the future if there becomes an economic problem for him to access insulin. And the reason that we need to pass this bill tonight is for those people. But it's for the larger purpose of demonstrating that advocates who come forward and have a passion and a belief that we need to solve problems come to the democratic process through the legislature and demonstrate that the political system, our state, can actually function together and solve problems and address issues. If you think that we can't do it because government isn't the solution, then I don't know why you're here. What's the point in being here if you can't save the life of a person who needs insulin because a government program failed in a different agency, a different context? Why bother to come here? I am here to solve problems. We are all here to solve problems. And the point of this bill is for insulin, but it's for the larger point of making sure that pharmaceutical companies know that in Minnesota, they have to be part of the solution or they will pay the price. And the public of this state expects us to do that. We can tweak this bill, we can change it, we can adjust it. But if you think that there is an industry that deserves to be protected and shielded from any kind of public accountability, who deserves to be able to operate and gouge people, costing them their lives, and not have any stake in solving the problem, you are out of touch with the lives of the people of this state. We need to come here together and solve this problem. We can do it. The Senate is willing to come to the table and negotiate. I believe that we can make this happen. The governor is ready to sign it into law. This should be the first bill signed into law, and it should be done next week. We have waited long enough. Please vote green.
The clerk will take the roll. The clerk will close the roll. There being 75 ayes and 52 nays, the bill is passed and its title agreed to.